If it's your goal in 2020 to have a perfectly aligned smile, Gargano Family Dentistry can help. Dentist Dr. Ted Gargano is here with the basics on clear aligners. Welcome back.
Thanks so much.
So I think the first thing that comes to mind is Invisalign.
Yes, yeah.
But there are many options.
Of course. So Invisalign is a brand just like Kleenex or Scott's toilet paper. There are many different brands that do this clear aligner therapy, so that's the proper term that we like to use. And it's a great way to straighten teeth, and it's one of the many options out there. So
how does it work?
So what we do is we have a consultation visit with the patient and make sure, first of all, that they're a candidate for it. Not everyone is a candidate for Invisalign. And then we take some photos, diagnostic pictures, and whether or not you're using a scanner, you can either digitally scan the patient and have a 3D model made of their teeth, or take a traditional impression, and that gets sent out to the lab. And then the lab and I have a conversation back and forth, a dialogue as to what kind of movements we want to create with the teeth, and that's why it's really important to see a clinician before this is done.
Okay.
And then the aligners are manufactured, and we deliver them to the patient in a series, and the patient is responsible for maintaining them and taking them in and out. So it's really important to have patient compliance involved.
Are there other problems that aligners can fix rather than just crooked teeth?
Yes, so a lot of people come to us saying, hey, I've got I don't like the way my teeth are, they're ugly, they're crooked. And, again, when I was here last time, we were talking about cosmetics, and I kind of stressed the point of, yeah, cosmetics are great, but we also really need to stress the importance of function. And so what clear aligner therapy really, I think, patients can benefit from is regaining a proper function in terms of their bite and aligning their bite so that they can avoid issues down the road, and having, if their bite is aligned improperly, their teeth can have there can be a lot of consequences involved.
Well, not to mention you want a nice smile too.
Of course,
build your confidence
and that's
a little
great.
bit.
It's a multifaceted tool that we have to correct many things. So again, like I said, patients will come and they want a straight, happy smile, and I say, great, we can make you look beautiful, but we can also help
fix the underlying
issues and maintain your teeth for years to come.
Great. What do you have here?
I have a few models here. These are just kind of some examples of what the clear aligners actually look like.
So you can't really see them at all.
Right, no. So if you take a look at this here, it's very, white teeth.
Yeah.
No brackets or wires, so when patients are wearing them, and they pop right on and off, which is really nice, really easy to remove.
Like an old school retainer.
Like an old school, actually, the old school retainers, the acrylic and the wire, those are even uglier and stuff. But these are great because, again, they're a custom fit to the teeth.
Yeah.
They fit right nice and snugly. Sometimes we have to put little composite or filling material attachments on the teeth to help create those certain movements, and that helps to hold the aligners in place. But these are, a really great way for people to correct their smile without...
painless too, right?
Yes.
That's fantastic.
What I've heard from patients is that it's on a scale of 1 to 10, 10 being like braces pain when you have it tightened, because I have a lot of people who have had braces but come back and they've had relapse. They say when they had braces it was so painful, but when they're doing the Invisalign it's like a 1.
Wow,
so,
that's fantastic.
About a tenth of the discomfort.
Well, an easy way to fix your smile. Dr. Gargano, where can we find you guys?
GarganoFamilyDentistry.com, and we also have an Instagram account.
Oh, we'll follow along then.
With before and after pictures of different cases that I've done. So it's at _Velociraptor.
Got that? All right, we'll find it. Ted, thank you so much for being here.
Thank you very much.
All right. Stay with us. More style coming up.